Good afternoon. We'd like to welcome you to our weekly press conference for today, April 3rd, 2020. I'm County Executive P.J. Wendell. With me today is our Director of Health and Human Services in Chautauqua County, Christine Schuyler. In the back, we have our Chautauqua County Medical Director, Dr. Burke, and also our Chautauqua County Sheriff, Jim Quattrone. Just to recap this week, on Monday we announced Chautauqua County's 8th confirmed case of COVID-19. That individual was also Chautauqua County's first death from COVID-19. On Tuesday we announced 2 cases, bringing our total up to 10. We also announced our county's first fully recovered individual. On Wednesday there were no new cases to report, and we launched our new online mapping tool broken down by the 4 county fire battalions. Yesterday we announced that there were 2 confirmed cases, bringing the total to 12. Today we have received 1 additional positive COVID-19 test result, a male in his 30s, bringing Chautauqua County's total to 13 positive cases. I'm also happy to report today that we have 5 individuals out of our 13 cases that have recovered. Today's numbers include the following: 17 people in mandatory quarantine, 19 people in precautionary quarantine, 76 people in mandatory isolation, and 160 negative test results have been returned to date. At this time, I'd like to take a minute, and we are going to look at how we access our updated map here in Chautauqua County. If you first go to chqgov.com, as you enter that, you will be directed to our county's homepage. On the right-hand side, you'll click on the red box stating COVID-19 information. Once you click on that, you'll see a large map of the county. Again, if you click on that picture, once that is there, you will see the 4 battalions. You'll notice that there are confirmed cases in 3 of our 4 battalions. Currently, where the 0 is, that is our 2nd battalion in Chautauqua County, and that has no confirmed cases. You'll notice we do have 7 active cases and 5 recoveries, which again is a pretty good statistic to show. Again, very easily accessible, simple to use, and it will be updated with our information. At this time, I'd like to turn the press conference over to Christine Schuyler, our Public Health Director.
Thank you. The launch of the map for Chautauqua County was after I think many people had seen the map tool that is being used by Erie County, New York Health Department. And the health commissioners and public health directors of the 8 counties of Western New York have agreed in principle on a uniform manner to share information with the public about COVID-19 cases going forward. And as local health officials, we absolutely know that it is imperative to share information that will help prevent the spread of this virus, while also protecting the privacy and well-being of individuals. In more rural counties, such as Chautauqua, details such as age, gender, township, employer, travel history within Chautauqua County or Western New York, and details of close contacts will not be released unless there is a clear and a compelling reason to do so that will protect the public's health. I want people to understand, I understand that people want information to help keep them and their families safe and healthy. But details of positive cases provide no such assurance, nor is there no such assurance that there is no novel coronavirus or the infection COVID-19 within the 2nd battalion on the map where it says there's a 0 for confirmed cases. That just means that we've had no lab confirmed case from that area. So to be clear, COVID-19 is circulating in Chautauqua County. And just because you didn't visit a particular location does not mean that you have not been exposed. My nursing staff is following up on all positive lab confirmed cases of COVID-19 in the county. Here we are, a lot of us addressing social media at the time, and one thing that everyone is very familiar with is a term that something's going viral. That is exactly what the novel coronavirus is doing. It is viral. Viral means it's spreading everywhere. So the best thing that all of us can do is to be very mindful of that, take the community mitigation strategies to heart that we have been going over and over. This is very serious, but at the same time, this is something that we're going to get through, and we're going to get through it together. And I guarantee you that it's going to get better, and we're not going to give up until it does. But that means we need everybody to play their part. It's going to require some sacrifice and some inconvenience to each and every one of us. But that really is what we have to do at this time. The weather is getting nice, hopefully. I know today the sun is shining, always makes me feel better. And the weather forecast for the weekend is quite nice. We encourage people to get outside and get some fresh air. At the same time, please remember to practice social distancing. If you show up at a normal location to go for a walk or walk your dog or something, and you see a lot of people there, choose a different location or maybe a different time of the day when it's not so busy. It's very important to maintain your distance from others in places where people tend to congregate, such as, the parking lots or a trailhead, or even some of our restaurants when you're waiting for your takeout order or you're going to order at a window, let's say. Ice cream is now coming back in style, which is great for us, showing that it's a nice time of year. But at the same time, it's very important that we maintain our distance when we're ordering and waiting for our food at these places. Please be courteous to others, and especially if you are sick, do not go out. Don't make that errand to the store to get your supplies. Don't go to pick up your food, that's even if it's takeout. Please call on a friend or a neighbor who isn't sick to do that for you. This also goes for our golf courses. We do have guidance from the State Health Department regarding gathering at places such as golf courses and our seasonal campgrounds that will be opening soon. Social distancing will have to be maintained at all of those places. And I just hope that everyone can abide by that, because those of you who do not will ruin it for everyone else who does. At this time, PJ?
Thank you. This time I'd like to turn the microphone over to Dr. Robert Burke, our county physician, to speak about masks.
Thank you, PJ and Christine. First of all, I want to reiterate what Christine just said. This is something we will get through, but we have to be very careful how we go about this. The history of novel viruses in the United States goes back a long time. The best model is 1918. The communities that did the best exercised social distancing. That was the only tool they had, and that's approximately the only tool we have, and that's fine. We know what works. Do not be conned into thinking there are magical cures out there. Our best guidance is social distancing. Keep your distance, stay at home unless you have somewhere to go, and then let's talk about what you do then. We have had in the news recently a lot of information about masks, and there's been some debate, and I think there has been a pivot towards possibly everybody using a mask. And I want to go through the kind of masks that are available and what you should and should not do. So in front of me, I have a series of masks that I'm going to demonstrate for you, at least briefly, and discuss who should use them, who shouldn't, and why. The first one, I have two models, but it's the same one. It's an N95 mask. It comes in blue or white, and it just fits very comfortably like that. It is only for medical personnel and people who are first responders. It should not be worn for anybody else. These are in extremely short supply. If you start to just use these willy-nilly, you are going to probably, in the end, deny the use to a first responder, and if they get sick, you have no one to turn to. So these are forbidden to be used by anybody else if at all possible. You are doing nobody any good by using these. They are extremely good masks, but they are that good for a reason. They protect your first responders and your healthcare workers, and they are at the moment very, very, very short supply. Along with that come surgical shields. This is a a very flimsy model that has been around for a while. This is a newer model. It's actually being produced right here in Brockton and is an extremely good shield. Again, these are not to be used by anybody but first responders in situations where there is a risk of spray or aerosolization of mucus or sputum or sneezing, and they should not be used by anybody else. They are in extremely short supply, and you should not have these. These are a surgical mask, which those of you who've had surgery have seen your surgical nurse and your doctor use. They are actually a very good mask. Again, extremely short supply, should only be used by medical personnel, first responders, but if you have an underlying immune compromising situation, are on chemotherapy, or you have COPD and are extremely respiratory distressed, if you have been told by your doctor to use this because you have MS or anything else that has disturbed your immune system, these should be used by those people as well. But don't drive in your car with it. Wear it when you're going to be exposed. They have fairly good protection against other people's breath or cough or sneeze. And they are, but again, in very short supply, so do not use them unless you're a healthcare worker or are immune compromised. Then there's my last one, which I really like. One of my staff gave it to me. It's got flamingos on it. And this is the homemade variety. This is what you should be using. And actually, as of today, I think you're going to see nationally, it's going to be recommended. Now, what does it do? For you, nothing. For everybody else, something. It's going to protect your spray, your breath, your sneeze, your cough from reaching 10 or 15 feet or 6 feet away and protect everybody else in the community. You can almost see through these. The holes in them are so large that you're not going to get very much protection from anybody else. But you're going to do a community service. You're going to be a very good citizen by protecting everybody else. The latest data, they suggest that 30% of people with COVID-19 have no symptoms, but are out there as super spreaders, infecting people, and it's not of their own volition. They just don't know they're sick. Wearing these will protect the population from the possibility that you're one of those folks and are spreading it without knowing it, because this will interfere with a droplet that you create if you cough or sneeze or just breathe or sing. And that will not go very far once it hits your mask. So you're going to do the community a great favor by wearing this and protect your neighbors. Again, it will not do very much to protect you, but the recommendations are that if we start to protect our neighbors, we may really improve the statistics that we're seeing. Thank you.
Thank you. At this time, as we've been made aware in the last couple of days, in light of COVID-19, the opioid crisis here in Chautauqua County still remains an underlying issue. At this time, I want to turn the microphone over to Sheriff Quattrone, who will address our opioid crisis.
Thank you. First, I want to start by saying we are thankful that we have a county full of providers, responders, people who are truly interested in our community and in an opportunity to offer hope to those who are around. But amidst this COVID-19 pandemic, we continue to be concerned about the ongoing drug epidemic. And we're going to continue to encourage individuals to seek assistance. We also want to encourage, if you know someone with a substance use disorder, to encourage them to seek help and support them in their efforts. In March of this year, we had 45 reported overdoses. 2 of those resulted as fatal overdoses. And without the use of naloxone, we would have seen a significantly higher rate of death. The spike we've seen in March is more than the combined total of any other 2 months over the past year. Mainly attributed to the use of fentanyl, whether it be intentionally or unintentionally using it, as it can be found in any of the street drugs that are out there. But that is the result of that fentanyl use is the fatal, or the overdoses, some of them fatal. We're going to encourage individuals to seek assistance through treatment providers and harm reduction services, which are still operating. The Mental Health Association is available to assist in connecting individuals to the clinics and assistance. Their number is 716-661-9044. We also have a resource in the county website, combataddictionchq.com, that is full of resources and information that you can access. And if you find yourself in a crisis, we have the Chautauqua County Crisis Hotline, 1-800-724-0461. We need to be willing to put that stigma aside and reach out and support each other. Thank you.
Just to add to that, our opioid crisis response team met with me this afternoon, and another team that we have here in the county will be convening and, again, ramping up their efforts and their plan to help combat this addiction. Again, as the sheriff said, our services are still operational for those who have opioid addiction needs or other crisis needs, so please reach out. Again, helping your neighbor is going to help all of us. At this time, we're going to open up the press conference to questions. We'll go through our media list as we brought them online today. So the first one will be Dunkirk Observer. Mr. DiAgostino, do you have any questions?
Yes, thank you. So there is a concern that we're hearing from residents around the North County and probably around the county that there's a surge coming, and there's a sense that the county is not prepared. Can you speak to the preparations that the county is making with the hospitals in preparation for a possible surge in upstate New York in this region?
Certainly. All of our hospitals were required by the state, I believe, 2 weeks ago. Christine, if you correct me if I'm wrong.
March 24th.
March 24th, I apologize, to submit a surge plan to the state. So those plans are submitted, and they have been, they will be enacted as needed. One of the things we need people to remember is all of our hospitals annually have to review those emergency plans, and every other year they have to carry out a drill to implement those plans. So I know, being part of them over the years as a first responder, UPMC Chautauqua has done so, and I'm very confident that it happened also in our other hospitals. But those plans are ready. They will be enacted as they are needed, and I feel very confident in our hospital administrations. I know personally, Director of Nursing at UPMC Chautauqua, also the ED Director at Brooks, very familiar with their capabilities, their strengths, and I feel very confident that they will be ready to handle this as it comes.
If you want me to elaborate a little on that, all of the hospitals within our county, in part of their surge capacity plans, they have had to increase their number of beds by at least 50%. So that means they have in place plans where if they need extra beds, they can make them. They can make them in an area such as a recovery room, a sleep lab. They can turn an area that's not being utilized anymore into an area for inpatient care. Every day, even before this happened, every hospital within the state of New York has to report to the state health department the number of beds that they have available, the number of ICU beds that they have, the number of ventilators, the number there is a laundry list of things that every day has to be submitted to the state health department. So I can assure you that those plans are there, and there is room for surge capacity within our county. We are hoping and praying that we don't see in this part of the state what is happening in the downstate, New York City and the downstate counties right now. But we are prepared as much as we can be for the limits of our own hospital systems. And that really is an increase in the bed availability. At the same time, we do need to be mindful that you have to have staff. When you increase your capacity for beds and ventilators and all of the services that need to be delivered, that people have to deliver those. And there again, that goes back to doing all that we can to keep our healthcare workforce healthy. Hence all of these community mitigation strategies and staying home when you're sick. In our county, there is a total of 252 hospital beds available. That's with surge capacity. And there are 21 ICU beds out of that, just to give you an idea. Hospitals. So at least we have some very credible hospitals in this area. I do know that Brooks Hospital Administration is in constant contact with the State Health Department. So I know that there are behind-the-scenes talks that if something were to happen that the TLC facility needed to be used again, I'm confident that it could be.
I have been in meetings twice a week with groups of physicians that represent the majority of primary care and some subspecialty physicians, and we are discussing, of course, the need to look at every patient that we deal with, mainly by telehealth now, to assess how we can best keep them out of the surge, even if they're sick at home, following them up. The second thing is, I know that at least UPMC, WCA, has done a change in their credentialing, and they're looking at making sure that a much larger number of physicians in the community are credentialed for the inpatient side of it, just in case they need to add to the caregivers at the physician level in that institution.
Thank you. Mr. DiAgostino, you had another question?
Yes, thank you. So what is the status of Lakeshore Hospital? You alluded to it. Is there a plan right now in place to open that hospital if needed? Because obviously Erie County is starting to feel a surge up there with their institutions.
I can't speak for the administration of the Brooks TLC Health System, but I can tell you that as part of their surge plan, Brooks TLC did have to include that campus. So I don't know of any specific plan, and I do not want to speak for the administration of the hospital system. But I think if it were to come to the point where the state health department said we need to mobilize, or the governor said to the state health department we need to mobilize, I have full confidence in the administration of the Brooks TLC Health System to do all that they can to make that happen. That hospital is still licensed under Brooks Hospital, under the Brooks TLC Health System. So that is who has ownership of that and the hospital within. Sorry, I hear noise.
Just to add to that, we were also informed last night that Erie County has been in contact with the Army Corps of Engineers and looking at mobilizing the Buffalo Niagara Convention Center, 64,000 square feet, into a potential 1,000-bed ICU unit for the region. So County Executive Mark Poloncarz did make mention of that last evening, and that is going to continue. So although not in Chautauqua County, regionally, there is another plan for an increased capacity if the surge arises. Thank you. Any other questions, Mr. DiAgostino?
This is the last question. Last week we touched on ventilators. We didn't have a number. Our newspaper took a look at it. We found there's probably 20 to 30 ventilators in the county right now. Erie County says it doesn't have a stock of ventilators. We apparently do. Any ventilators going downstate since the order issued today?
There are 46 ventilators between our county facilities. It's a combination of bedside, adult, pediatric, and transport ventilators. And as of this moment, there is no plan that I am aware of to transfer any supplies to any place downstate. But having said that, as the county executive, I'm sure will say, the Governor Cuomo could come out with directives that we just aren't aware of. But right now, there's none of that we're aware of, and we're certainly hopeful that we continue to stay where we are on our very far southwestern side of New York, which most people in Albany don't even know where we are. So it's usually a good thing.
To answer that a little bit more, the directive, the potential executive order as announced by the governor at his press conference today, did make a mention of the borrowing, as we were told, of ventilators. Immediately, I was in contact with Senator Borrello, who's also been in contact with our Assemblyman Goodell and Congressman Reed, and we are working on that. We are opposed to that. We are keeping in mind the safety of the residents of Chautauqua County, and that is something we are working on at the present time. That was about 2 o'clock this afternoon, and I have not heard back from Senator Borrello, but we are in constant contact along with Congressman Reed, and we just got off a conference call within the hour, and the same sentiment in upstate communities, counties especially, has been shared, and there is a lot of concern and a lot of opposition to that governor's order. But again, if it's an executive order, we are going to be faced with that challenge when it comes down. Thank you. Any other questions, Mr. DiAgostino?
No, thank you very much.
Thank you. WDOE, Mr. Dave Rowley.
Good afternoon, everyone. Wanted to just hitchhike on ventilators. 46 you mentioned. Is that sufficient to handle a surge if we should see it here in Chautauqua County?
Oh. I honestly don't know, Dave, because we really, this is uncharted territory for us, and I can't say yes or no or make statements or promises that I honestly don't know. At 46, that's a pretty good amount for a county of this size and for the amount of disease we've seen here. But if we get the surge and uptick that everyone else has, then that's when the prioritization of resources is going to happen. And I don't know, Dr. Burke, if you have it.
I'm trying to do the math. If you look at 40,000 for 13 million in New York City, and you scale it down, in my head, I can't figure it out, but we would be pressed, and everybody would be pressed. It's just a surge that is beyond any of our previous conceptual planning. Not that that's a great statement, but as you know, the whole healthcare system has been stretched to its limits and beyond. This is a novel experience. Everywhere you look, systems are straining. The most encouraging part of this whole process is looking at what's going on locally in each of these small communities where people are making do incredibly with very, very tight supplies and just getting very creative at looking after business. So the answer is probably we don't know. And what we're trying to do is make sure that everybody we can keep out of hospital to keep those beds free will be kept free. Also looking at the experience, and I think we had a conversation this morning where one of our ER physicians, Mike Falk, who's one of the county physicians, was saying some of the experience they're now looking at with younger, healthier patients, they may do well enough off ventilators just with oxygen support because they're so healthy that we may have been a little too exuberant intubating people and putting them on ventilators, which puts them at extremely high risk. The data are very poor on people who are on ventilators in this situation, about 70% mortality rate. And that's probably because they're extremely sick, but also I think some of the experience is that younger people, we could probably oxygenate them and keep them off. So we're learning as we go with this. This is a novel virus, as Christine said. We don't know much about what to do with patients except to support them. And we're learning as we gain experience, which is unfortunate, but it's the way we're going. So, Dave, your question is very appropriate, and the answer also is we just don't know. We will do the best we can.
You know that if you smoke or if you vape, you are really hurting your chances of having a mild case of COVID-19 if you get it. So the best thing you can do for yourself right now is quit. And I know that's a big demand, but I'm still not chewing my fingernails. And for those of you who saw that. But in reality, smoking and vaping are very, very serious threats to your respiratory health. And stopping today actually will make a difference. You will immediately start to recover some of your lung function. And when we're seeing some of the healthy young people who are contracting COVID-19, and then we find out they've actually been smoking and a lot of them vaping, then that's where we're seeing a lot more issues with their lung function.
Thank you. Dave, any further questions?
Yeah, just on this, there's been talk at the state level. I know Governor Cuomo a couple of days ago talked about a rolling apex. New York City, they're talking anywhere from 7 to 30 days they may see this surge, and then this apex would roll upstate. Have you guys had any idea when it will reach our area, or is it, again, kind of pretty hard to determine?
I think it would be very hard to determine at this time. And if we look at things where we talk about storms, there's models we use. There aren't any models we can use right now that predict this type of activity. This is a, once in a lifetime experience. So the experts are trying to do the best they can, but we don't know any date. The governor termed it a slow-moving hurricane. We don't know what that means. Is it going to be a week? Is it 2 weeks? Do we take, where the surge is from New York City and then add 2 weeks to that? We don't know. There's a lot of unknowns. This is very fluid, so as that information comes out. But as we said before, I feel very confident that our hospitals, and I know our emergency services staff here, first responders throughout the county, have been preparing for this. And like any other challenge, and we will rise and we will meet that as best we can and as prepared as we can be.
One thing that we do know that any of the community mitigation strategies that are in use are what are decreasing. They're flattening that curve, and that is already being seen in areas where their time for people to be hospitalized or their condition deteriorating is doubling or tripling in days, and that's a good sign. That means the spikes aren't as high, and we're doubling or we're flattening that curve some. The University of Buffalo is working on doing some of those sorts of projections for the Western New York area. So I think when something like that becomes available from UB, I'm hoping we'll be able to get our hands on it and get it out there for everybody.
Getting back to the data from 1918. There's some really beautiful mapping done of those communities that did very early mitigation and went to social distancing, and their curve looks entirely different than the curves that took place in places that adopted late. I think there's still 13 states in the United States that haven't instituted social distancing, and I can almost bet that their curves are going to be show a very sharp uptick at some point, while the communities, and this community started a while ago, encouraging and not enforcing, but strongly encouraging with good messaging that social distancing will help. And instead of seeing a bell-shaped curve that goes up and down like that, you see a curve that has a much flatter peak and a longer tail, because you're going to get cases out there on the tail, but that you're not going to see the surge. And the surge is what's killing us. We are just incapable of managing that volume of such intensely ill people at one time. If you can mitigate this by flattening that out and forcing it, keeping people at home, keeping people away from each other, you're going to lessen that volume of folks at any one day who are going to be critically ill. And that is the game we have to play. It is really an unfortunate but necessary model that we have to look back at previous events like this and be smart about it. Learn from your history. We don't have to learn this a lesson over and over again, which is what we're doing in a lot of communities, that we don't have 100% stay-at-home social distancing across the nation. We're guaranteeing that we're going to see community by community go through the same painful lesson of getting a surge and having to deal with it, as opposed to pushing this down as far as possible and stretching it out where we can manage it.
Thank you, Dave. Any other questions?
No, all set. Thank you.
Thank you. This time, Western New York News Now.
Hi there, can you hear me?
Yes.
Okay, my question is for Sheriff Jim Quattrone, actually, speaking from another angle here on the virus. I spoke with Chautauqua County DA about a week ago. He said that he expects to see a dip in most crimes due to the coronavirus. So thus far, has your deputy seen a decrease in crime throughout the county?
It appears that our calls have stayed the same out there, and my concern is the public and how they're gonna be dealing with the social distancing, and we're just gonna continue to encourage people to be courteous and respectful of one another. Find positive ways to get out, and I know we talk a lot about social distancing. That doesn't mean that we have to stay out of contact with people, and I would encourage people to use the resources we have, whether it's the telephone, we still have those. We can also use Zoom and Skype and different ways to reach out to our neighbors. But I think it's gonna be even more critical as the time goes on that we are reaching out to individuals that aren't able to get out and offering to assist in the ways that we can do it, while at the same time practicing that social distancing or spatial distancing.
Okay, that's it for me. Thank you.
Thank you. Mr. O'Connor for Shawcat.
Yes, I have a question for Sheriff Quattrone. The U.S. Attorney up in Buffalo yesterday put out a long and detailed statement about how bail reform, he believes, resulted in at least one unnecessary OD death. And that was because the people involved in this had been arrested 3 times, February 20th, for possession of narcotics, distributing narcotics, and in each case had been set free. 3 times in 24 hours, set free, and then subsequently, 4 days after that, allegedly had distributed a fentanyl-laced heroin dose to a person in the Buffalo area who could not be revived with Narcan, and then was taken to St. Joseph's Hospital for resuscitation, which was unsuccessful. Do you have any comment about these overdoses in March perhaps being because people are arrested and then released?
I do not have any comment on that. I believe that we need to focus on helping and offering the hope to those who are struggling with substance use disorders. We can point fingers and we can blame. I am opposed to much of the bail reform, even though I believe we needed some of that. But I don't believe that that's always going to be prudent or beneficial to point the fingers at something else. We need to have an opportunity to offer hope and work with those offering services and encouragement to get the help that they need.
Thank you.
Any other questions? Okay, we'd like to thank everybody for tuning in to our press conference this afternoon. We'd just like to remember for everybody to stay home, stay healthy, stay safe. If you're returning to this area, we strongly urge you to quarantine yourself for 2 weeks, 14 days. Reach out to your neighbors, reach out to family to get your supplies as they're needed. As the sheriff said, this is social distancing, not social isolation. The state has encouraged a Take 5 initiative. That means take 5 minutes to reach out to someone, whether it's a family member, a friend, a neighbor, just to make sure they're doing okay and see if there's anything they need. But again, the message I've been saying right along is to stay home, stay healthy, and stay safe. And in the end, we will be CHQ strong.